So we're back now to look at the hip, but first I want to recap and go over a little bit of what we've done already. One of the most important things is just keeping that information fresh in your head. So again, I'll pause and give you a moment to consider. Feel free to pause the video as you need to think about the answers as we go. So this bony prominence, we'll start in the middle here. We talked about this bony ridge and we called it the iliac crest, part of, remember, the ilium bone. The ilium bone fuses together with two other bones to create the pelvis. Remember, we have the ilium, the ischium, and the pubic bone. Then those fuse together, the pelvis fuses together with the sacrum to create a joint that we call the SI joint, the sacroiliac joint. And we've got these bony prominences here called the PSIS. This bony prominence here, spine of the scapula. This bony prominence here, the greater tuberosity or tubercle. This groove, the bicipital groove. This bony prominence, coracoid process. This bony prominence here, greater trochanter. This bony prominence here on the front of the hips, the ASIS. This smaller bony prominence, the lesser trochanter. This joint here, the AC joint. And this bony prominence here, this flattening, this is the acromion. Then this divot that the head of the humerus sits in is called the glenoid fossa, and we have the head of the humerus here. Then we have above the spine of the scapula, the supraspinous fossa, and below the infraspinous fossa. How many cervical vertebrae? We got 7, thoracic. We've got 12, lumbar. We've got 5. Then we looked at some of the articulations of the vertebra themselves. We've got these pointy prominences off of the sides here that we call the transverse processes. Down the back, we have the spinous processes. Then in the center, we've got this opening through the vertebra called the vertebral foramen, where the spinal cord is going to run through. Then we have these little joints here above and below each vertebra, connecting the vertebra, called the facet joints. And maybe you can remember the 3 weight-bearing joints of the spine as well. Remember, we have 2 facet joints and 1 body, or the discs, that create those 3 weight-bearing joints. So the body and the discs together, and the 2 facet joints, 1 on each side in the back. So that as I come into flexion, I'm putting more weight into which one? Remember, that would be the front, which would be the body or the disc. And as I come into extension, I'm putting more weight into the back, which would be more of the facet joints. We also talked about there being a set of spinal nerves that come out between each segment here to innervate the body, innervate the rest of the body, both the organs as well as the extremities and the muscles. We've got the cervical spine innervating the chest and the arm. The thoracic nerves innervating the torso and the organs, both in the chest and the abdomen. And then the lumbar spine innervating the legs, the bowel, the bladder, and the pelvis. We talked about some of those important points of the discs, and really one of the things we came to over and over and over again was this balance, this yin and yang balance that we see in pretty much every organ system, as well as all of the muscles, as well as the spine, the discs, this balance that the body wants to keep coming back to. And in the musculoskeletal system, we see this in the muscles themselves, this balance of being able to be flexible but also be strong. We talked about this importance within each muscle to be able to be flexible and strong, to be able to fulfill its function, to support us, to contract and support us, but also to lengthen to allow for our mobility. Then we also talked about this trampoline system around the joint of this balance between the tissues in the front and the back and the top and the bottom to be able to position the joint properly. And remember, the main purpose of that, maybe you remember one of the big purposes we talked about. In fact, there were really two. One was our ability to move efficiently, and the other is to decrease wear and tear on the joint or degeneration in the joint. So one we can feel right away, our power, our ability to be more efficient in our movements. The other, remember, we can't really feel right away. Remember, primarily because what we talked about in the cartilage was this concept of it being not having direct nerve innervation and being avascular, and that it can't heal and repair. So when we look at this system, remember the importance is looking for balance. We don't have to overthink that, but we want to keep looking for things that are challenging, either because they're limited in their range of motion, tight, or because they're not firing properly. Maybe there's also some weakness. And looking for that ability to create balance. In the joints, remember we talked about layering of the joints, and the synovial joints in particular. This was the main one we talked about. Remember, most of the really movable joints of the body will be synovial joints. And the features of this layering of the joint, remember the first feature of the joint is going to be the bone. Right? And remember we talked about the shape of the bone will predispose us toward or away from stability to some extent. We looked at the difference between the shoulder and the hip briefly. The next layer on top of the bone, if you remember, if you can think about it just for a second, the next layer on top of the bone is going to be the cartilage, right? So we've got the articular cartilage covering it to protect the surfaces of the bone rubbing against each other. And then we also talked about some other fibrocartilage, the labrum and the meniscus, as allowing them to kind of come together more kind of closely knit to each other, allowing them to connect more specifically to each other, but also helping to absorb some of the impact and help to decrease wear and tear on the joint. So we've got bone first, second is cartilage, third, if you remember what the third layer is on top of that, we've got the capsule on top of that. So bone, cartilage, capsule. Remember the most important feature we looked at with the capsule, if you remember, we have the outer layer, the fibrous layer, but the inner layer is going to be the synovial membrane that secretes the fluid. Remember how important the fluid is for decreasing wear and tear on the joints, these joints that are moving so frequently. And then the last layer on top of that we had in those kind of deeper layers of the joint, we had the last one right on top of that being the ligaments. Remember, the ligaments are going to help to really reinforce that capsule, reinforce that integrity of connecting bone to bone. The features of the ligament connect bone to bone. Then on top of that, remember we have all the active stabilizers. So all of those are going to be layers of passive stability. On top of that, then we've got the muscular layers and the tendons that connect the muscle to the bone. We also talked about the ligaments and the tendons being less vascular, so they heal much more slowly, especially than the muscular layers. And we talked about different types of contractions of the muscle. So maybe you can think for a second and consider which muscular contraction was actually, maybe you can think and consider what the eccentric contraction was. Remember, we talked about eccentric contractions as being a contraction where the muscle is engaging as it lengthens. And we talked about this in chaturanga with the triceps, keeping us from falling on our face, but actively engaging so we don't fall on our face, but also lengthening as we come down. We talked about the quadriceps coming down into Virabhadrasana B as well, an eccentric contraction. And maybe you can remember what isometric contraction was. That was the other main one we talked about. Remember, isometric contraction is going to be anytime we're contracting without movement. So really this happens in pretty much all of the yoga poses when we're staying static in a pose, anything that's engaging to hold us upright. And usually that's many muscles as we come into a pose. And remember, partly this depends on our cueing, the style that we practice in, what we're paying attention to, really our mindfulness in the practice, and how we support and recruit muscles. And it's a beautiful thing in our yoga practice too, is our ability to intervene with our mindfulness to be able to wake up certain areas that go dormant, to allow us to find this balance, to find the areas that tend to go a little bit more quiet in our body, that don't do maybe the job to support and stabilize, and to kind of pay attention to the areas that tend to over-recruit or overcompensate, using our mindfulness to try and find this balance through our awareness and our ability just to pay attention. So then we talked about the shoulder, and we got into all of the stabilizers, the main stabilizers of the shoulder joint itself. So first off, remember with the shoulder, there's 3 bones that we're looking at. Maybe you can take a moment just to consider the 3 bones we've got. Remember, the obvious one is the humerus, the familiar one. The next one we have is also the scapula and the clavicle. And you can see here on Fred how they connect. We've got the clavicle connecting via the AC joint, and then the humerus connecting via the glenoid fossa. So we have this shoulder complex that is made for mobility. Because there are more moving parts here, it allows us to be able to move the arm a little bit more freely. So you can just take a moment here and imagine this on yourself. If you were to take your hand and pin down your shoulder blade. So just grab we'll say the right side shoulder blade with your left hand. And I'm going to pin my shoulder blade down and just start by moving my arm here. So you can see how much movement the humerus gets. And if you're really able to hold the scapula down, which is actually hard to limit all of the movement of the scapula, if you're really able to hold it down, you're not going to get much higher than 90 degrees here. You might get a little bit higher than 90, but you're not going to get a lot higher than that if you're really holding it down. So you can see my humeral head movement. Now I can also then just move the scapula without moving my arm and feel how much scapular movement I get. Then I can add them together and see how much range of motion now I get because I have those extra bones in place there, and this 3-bone structure of the shoulder complex that allows me to do all of these movements behind me and overhead and all of this stuff that I need to be able to do to interact with my hands. We do a lot more with these guys than we do with these guys here. So it's important that we have that mobility to be able to move around. So remembering that this joint, because of that, when we look at this kind of just this simple setup of the structure of the joint, we recognize that this joint is really made for mobility and that stability is not necessarily a guarantee. So when we look at this, what that means to us is that as we start to weight bear on our hands, we have to be able to pay attention to turning on some of these muscles that might potentially go dormant. The other thing we talked about was this difference between superficial and deep muscles. Remember the superficial muscles being the prime movers. These are the ones that kind of make the big push-ups and the pull-ups and the big stride forward into our gait cycle, our running or walking. But the deeper muscles, remember, being the stabilizing muscles. I talked about throwing the skeleton across the room, and those deeper muscles are those muscles of cohesion and integration of the system as a precursor to efficient movement. So that as I'm able to use all of these muscles in a community together, these smaller, deeper muscles allow the larger, more superficial muscles to be more efficient. And when they work together as a team, it also decreases wear and tear on the joint. The tricky thing we talked about, though, is that these deeper muscles tend to be more mindful. We do want them to be automatic, so at some point I shouldn't have to be thinking about them. But in many scenarios, especially in the scenario we see where someone comes in and starts a yoga practice, maybe even a vinyasa practice where they're doing a lot on their arms after maybe doing very little beforehand, that these muscles might not turn on automatically. So we looked at how to turn those on, and you got to play with some scapular push-ups in your yoga practice and play with some of that awareness of the movement of the shoulders in your yoga practice and really feel that as well. So in order to do that, in order to stabilize the shoulder, we have to find this balance of stability that comes from 2 main parts. We talked about that quite a bit. So maybe you remember the 2 things that we have to stabilize in order to stabilize the shoulder. We've got to stabilize the scapula, and we've got to stabilize the head of the humerus. And that's where we talked about 2 main groups of muscles, the scapular stabilizers and the humeral stabilizers. The scapular stabilizing muscles we had 2. Remember, we had the serratus anterior and the rhomboids. We also had the humeral head stabilizers. Remember, we had 4 of those. As a group, we called them the rotator cuff, And remember, each one of them individually will start from the front. The muscle of the rotator cuff on the front, we had the subscapularis. On the top, supraspinatus. On the back, infraspinatus and teres minor. Remember the Batman and Robin. So if you think about this, now we'll kind of go through some of the actions that we looked at. What is the muscle that we looked at that protracts the shoulder blade? Remember, first off, protraction is drawing the shoulder blades apart. So I'm stretching the skin in between the shoulder blades. Remember that muscle that we looked at, the primary muscle we looked at was the serratus. We talked about another function of the serratus. If you remember, the other job of the serratus we talked about was to pull the scapula onto the back. So we talked about this as scapular stability. We also talked about it as preventing that winging of the scapula or drawing the scapula onto the rib cage. And really all of those are kind of a similar function. The antagonist to the serratus, which muscle did we have that was the antagonist to the serratus? Remember, antagonist means the opposing muscle that does the opposite action. So the antagonist to the serratus is going to be the rhomboids. And remember, this was the one we looked at that is more familiar, our heart opening muscle. So all of these postures in our yoga practice where we do this heart opening back bends with the arms behind us. For the serratus, we looked at those scapular push-ups. But remember, both of these should be working anytime I'm weight bearing on my hands because these are my scapular stabilizers. So if I'm bearing weight on my hands and the scapula is not winging off of the back, these muscles are going to be the primary muscles that are creating that stability to hold the scapula on the back. However, remember we also mentioned that that doesn't mean that the scapula should never wing. Anytime I'm not weight bearing, it should be able to move freely around. We're really just talking about when I'm putting weight on my hands, that these guys are kicking in. I gotcha, literally I got your back. You're ready to go, and now you can move around and support yourself. So which muscle did we talk about was the main one that would internally rotate? The humerus. Think about the positioning of the muscles here. And if we think about that internal rotation, we can consider that the subscapularis on the front of the shoulder here is going to be the main muscle we talked about to internally rotate. Its antagonist, remember, is which muscle? So again, if you think about this, looking at the positioning of the muscles, the antagonist is going to be the mirror image on the back side, so the back of the rotator cuff, the infraspinatus and the teres minor, pulling it back, contracting here to pull it back. And then the supraspinatus function we talked about was what? Remember, supraspinatus is going to go right under that acromion, contracting to bring it into abduction. Remember, the primary function of all of the rotator cuff is really to stabilize the humeral head. Remember, it barely crosses the joint, so it's not going to be a huge mover of the arm as much as a positioner of the head of the humerus and the socket. And they're all going to work together to create that. Great. So we've looked at these kind of primary components of the stability of the shoulder. Clearly, there are other muscles we'll look at later. But in fact, many of those muscles are actually probably already pretty familiar to you. So we're going to get the guys in that seem to be less familiar to us usually first so they can be clear in your mind. And then we'll add on some others later that'll be a little bit more familiar to you. So let's shift gears and do a little preparation for our anatomy of the hip before we move into the muscles specifically. And we can kind of look at them in context of each other. We're going to switch gears now to the hip joint. And we're going to look at this joint first and just see, we've already talked about this a little bit, the natural tendencies of the bony structure of the hip joint here. Remember, we have the head of the femur here sitting in the acetabulum, the cup of the pelvis here. And we've got a naturally really stable joint. In fact, you can see just how well covered the head of the femur is. And his kind of sticks out a little bit because he's got some metal rods and screws there. But how well encapsulated it is. In fact, if you were to look in a cadaver, it's actually very difficult to distract and pull the femur out of the socket. It's really well encapsulated within not only the bony structure, but also the labrum, the capsule, the ligaments that all keep it really well contained, which is really important because we're moving and walking and standing on our legs all the time. So this needs to be a really strong weight-bearing joint. So we also see, though, that this is a ball and socket joint. Remember when we looked back at the joints, we saw different types, right? We looked at the hinge joint, We looked at the gliding joint that has very little movement. The ball and socket joint still has a lot of movement, which we're pretty well aware of as yogis, as yoga practitioners, that we get a lot of mobility in the hips, but we also have a lot of natural stability. Now, one of the things we run into here that is kind of a bigger topic, but I want to just plant some seeds for you. There have been a lot of fantastic teachers who have talked about this and really created a lot of awareness around this, but there's a lot of differentiation between person to person between the bony structure of the hip from one person to another. And if you look at the shoulder, you can see why it's going to be more important in the hip than the shoulder, because it's so much more encased. You can imagine that if there were a bony change in the shoulder, I might not even know it because it's such a free-floating joint. If it were right in the right position, I might find out pretty quickly. But for the most part, the bony changes aren't going to be quite as in our face as some of these bony changes might be. You can imagine, because it's so well encased, that if there's different changes in how the head of the femur is shaped, the angling of the neck of the femur, or the shape of the acetabulum, that it might really influence our range of motion quite a bit. So it's really hard to know, even with MRIs and x-rays, exactly how much that's going to change things without opening someone up and looking inside of there, which probably wouldn't be worth it. As a yoga teacher, though, it's important to keep in our heads that everyone's hips are going to be slightly different, and sometimes it might just be a bony structure difference. So we kind of reorient our expectations for changes within some of the postures to be open to the postures looking very different in one person to another. So when we look at the hip, we see this natural inclination towards stability. Now clearly with some of that bony changes, if the bony structures were to change significantly, that might also influence the stability, making it either more stable if the bone is covering more of the femur there, or less stable if it's covering less of the femur. And again, that can happen to a small or a large degree. So when we look at this, we have a pretty straightforward joint, which is really nice, in comparison to something like this where we have to think about supporting all these different bones. All I really have to pay attention to is this one ball and socket joint of the head of the femur sitting in the acetabulum. So I know it's already pretty stable. However, I also know I'm standing on my feet, so I really want to pay attention to this balance, again, of stability and mobility, of being able to have good range of motion, of looking at the poses that are difficult for us, range of motion wise, and really paying attention to those rather than working deeper into the poses that maybe are already really easy for us. And trying to find that balance around this three-dimensional trampoline as you investigate in your own practice. So just a quick reminder before we move on to the anatomy of the movements we have here. Remember, we have hip flexion and hip extension. We have, move Fred a little here, abduction, abduction, and adduction, adding it back in toward the midline. We have external, let's see if his screws will let him, external rotation and internal rotation. And those are going to be the movements of the hip and any combination, clearly, of those together. So when we come back, we're going to add on some of the layers of the musculature, but it's really helpful just to have an understanding of that structure first. So now you're ready to go.